age also, but like your ability to suture. Because it's gonna be really hard to see what I'm doing with so many people. So what I'm going to do, I'm obviously just gonna do it and then everybody watches, but I'm gonna focus in on the strong suturing individuals. That way you can go off into little teams. And the first thing, so there should be 3 blood pressure cuffs over there, right? Okay. So you guys, none of you have ever sutured before, right? Then can you go over on that side? Everybody else has never sutured. Anybody over here who doesn't know anything about suturing that needs to go over there? You guys can do a switcheroo. Yeah, okay. Now we're all in correct order. And you guys are like in the middle. Like, perfect. Okay, so Megana. So I want you, you need to borrow a shirt, and I'll give you a manly shirt.
That's fine.
This one's got to come back to me, but you will get a t-shirt to keep at some point. This is just for...
I put this on you.
Yeah! Alright, so... Silencio, por favor. So, this group over here, Megana, is going to teach them how to take blood pressures, while the very strong suturing individuals are going to be mastering their skills. And then once I have at least 4 or 5 masters, they're going to come over and help you guys who've never sutured before. Does that make sense? Because if all of you try to see what I'm doing, it might be very difficult. Okay, so the first thing that we're going to do is make sure everybody's got their gloves on. Okay. So open up your kits, and there should be one for every 2 people or one for every 3 people. I do not want anybody touching any needles or anything sharp. There are blades in there. Do not open. The only utensil that I would like you to have is this utensil. Anybody know what it is called? A needle driver. Correct. Why are you not over there?
I actually don't have any experience.
Then how do you know what this is?
Watch some stuff.
I don't know. I think you should at least go in the middle. Yeah, at least go in the middle. All right, watching some stuff. Okay, so yes, this is a needle driver. And what do we think that it does?
It drives
The needle. So, like you're sewing, silencio, por favor. When you're sewing, you use your hands, right? Is that how you stitch up skin? No. You use your instruments to do it. Okay, so you have a needle driver. Does everybody have a needle driver out? Not scissors. I don't think I need to define what scissors are. Everybody knows what scissors are? Okay, the needle driver. Do not touch the scissors. They're too sharp for you guys. No, I'm just kidding. Does everybody have a needle driver in their hand, or at least is sitting next to somebody that does? Okay? Because while I am talking, I want you to practice opening it and closing it, and opening it and closing it. Now, see what I mean? It's going to be hard to see. Is that a flattering angle, Sid? I really don't feel like it is. Let's stand up. Come on. And do a filter or something. Come on. All right, so you put your ring finger through this hole here, which would be on the right, and this hole here on the left has your thumb. Does everybody either have that or is looking at somebody who has that? See? Okay, and then your pointer finger goes pointing up like this. I will walk around and make sure because all you're going to practice, and I don't want you practicing incorrectly. Riley, take notes. There. Let's have this finger. Okay, do you know much about suturing? No. Then you need to be over on that side. Okay. Close. It's hard. Yeah, you gotta work the muscles. Hello, ladies and gentlemen. That is it. Okay, you got this? Let's put this aside. Yeah, let's not. Well, not there. Just like float.
I guess it makes sense, because you need more like.
And you can push down when you need to open close. You need to work out your hand muscles.
Yeah, my thing is how do you open your mouth?
We gotta practice a whole lot. Open, close, open. Yeah, so I push my thumb forward and I pull my ring finger backwards. Understand that? Ladies and gentlemen. So that is not a needle drive. But you know what? You can use it to practice up the muscles.
I think I only have one, but.
Those are actually forceps. They're a different type. But if you want to practice right? It's like jumping jacks. Let's see if you never have to back. Why don't you look at mine? Okay, your thumb goes in over here. Your ring finger goes. Yeah. Well, that you have to practice.
But I'm not quite sure what I want to do, so.
It's muscles in your fingers. Are you looking at? Very good. Okay, no, 20. That's okay because you guys are young and or have never sutured, and we're going to focus on taking blood pressure.
And Megana is going to teach you.
And then once you guys
Yeah, I did, yeah. And then like while you're.
The girls are
Okay, so does everybody have their ring finger through here on this side, and their thumb through this hole on this side, and their pointer finger pointing up? Okay, now practice, open, close. It's not easy. It takes years of practice. You're gonna go on Amazon and buy one, and then every night you're gonna do 10, okay? And then by the time you get to medical school, your hand muscles are just gonna be so strong, and everybody's gonna be like, wow, that suturing, they were so good, okay? You guys see?
I think I'm suturing.
No, that's right there.
Yeah, you have to practice. You have to get your muscles. You gotta do hand push-ups, hand sit-ups. It's difficult. You gotta practice it a lot. Everybody's opening it and closing it, right? When you go home today, you're gonna be like, dang, my hand hurts, okay? That's how you know you did good at the gym. You feel that burn? You're gonna have that burn in your hand, okay?
Are you sure it's not so?
Yeah, I'm sure it's not true.
No, try it.
Yeah, it takes practice. Okay, I'll let you practice that for a second. Okay, so now we have forceps. Okay, they're not called tweezers. There's two types that I want you to learn about. These are Adson. I remember it as Adskin because these are for skin. They have teeth. All of yours should have teeth. So the next instrument that you're going to get out are these right here. And what are they not called? Tweezers. And what are they called? Adson. Yes, these are Adson, Adskin, foreskin. The one without the teeth, meaning they don't have this like scary little bit here that's sharp. Those are for tissue. So what I'm teaching you is more along the lines of stitching up like an external injury, like if you get cut and you're stitching up. When you go into surgery, you are gonna be sewing up things inside of a person. It gets way more complicated, a million more tools and different things. So this is very, very superficial, both on the body and metaphorically speaking superficial. Like the basics, okay? So we're only gonna use the skin forceps. We're not gonna get into tissues. We're not gonna learn how to stitch up organs and stuff today, okay? So everybody get out your knot tweezers. Look at you. Okay, does everybody see that there's a little tooth? Okay, Adson. Okay, so everybody has them out and looking at them, okay. Alright, so. And then I don't need to go into what scissors are. Okay, that's great. So the next thing that we're going to learn about, there's different needles and they're curved. They're not like sewing needles that are straight, they're curved. When you use your needle driver, you don't want to put the needle driver at the tip of the needle because that will dull the tip of the needle. And that would be very hard to do suturing if you are using a dull needle. So you want to do it about 2/3 of the way back because you don't want to do it all the way back on the needle. So here's the thing with needles. If I find one needle out of place, what happens to everybody's grade for today?
0.
0. Even I get a 0, okay? I will give myself a 0. This facility was kind enough to have us. I don't want some needle stick injury going on, okay? So everybody will be very responsible. Everybody signed your release papers. If you're not 18, your parents signed, and everybody signed that they will be responsible with needles, correct?
Yes.
Correct. Legal liability purposes here, people. All right, so do not open it yet. I know we're all very tempted. And if there are scalpels or blades in there, don't even go near them because we're not getting into that today at all. All right, so I will use a silk braided. Okay, no one is opening this, you are just watching, okay? When you open it, there will be this little white cardboard square. I guess it's a rectangle, I'll have to ask my daughter. Now, you open it up. Here's the needle, do you see how it's curved? What is this angle? Stand up, man, you're young. Okay, yeah, there we go. See right there? Now, you take your needle driver, just like I taught. This is the part where you can actually touch the needle. You can pick it up like this, but I'm gonna trust you all to use your fingers. And these gloves are enormous. Okay. The way that you want to load your needle driver, and it's wood. If you want to get close, now's the time because I feel like from 30 feet away, you're not gonna be able to see this at all. So no pushing and shoving, okay? No, I'm just kidding, you guys can push and shove. All right. Some people can kneel, some people, well, no, squat. Like, we're working out our hands and we're also working out the glutes. Yeah, so some people squat. There is a 0% chance that you guys are gonna be able to see this. A 0% chance, so come on. The needle, it is curved. Do I want to load it like this, right in the front and dull the tip? No, I don't. Do I want to do it all the way in the back? No. I want to do it too. Well, I like that you responded though. I like that better than the silent people. 2/3 of the way, kind of like that. Okay? Now, do I want it all crooked, pointing up like this? No. You want it straight across like this. You see that angle? That is an amazing angle. Look at that. Does everybody see? It's like a T.
We got a side view.
Okay. I will rotate. Okay. That is how you load your needle driver. Now, you have this. Well, I open silk. We're gonna put it over here. Okay. We're not gonna get crazy and do any of these squiggles, okay? Like I said, very superficial. Both on the human body and metaphorically, very easy, okay? You guys are just gonna practice on this right here. This is the basics. This is an easy one. Okay, I'm just gonna do it first, and then the second time I do it, I will explain. All right? All right. I hope that's not my kid screaming out there. Bam! Okay, so I will try to narrate the next one. All right, so we're gonna load it. We're not gonna poke ourselves, right? Very tempting. Let's make sure the stringy isn't tangled. There's a knot in this, but I'll ignore. Okay, so what should I put it like this? Is this good or is this bad? This is not gonna work out. I'm gonna make it like, it's too far back and it was tilting downwards. So we need this wonderful, 45-degree angle? Okay. Now, why would you not use your fingers? Right. Exactly. You don't wanna go like this, because that's dangerous, and then you'll end up in the office where they give you the prophylactic for hepatitis and HIV if you get a needle stick. You don't want that. That is a very multiple day long consuming process. You want to not have a needle stick, okay? I've had one. Our first day of medical school, they gave us these cards, these laminated cards to put in our pockets. I feel like you're too close. To put in our pockets to know what to do in case of a needle stick, because like literally everybody will get one. Statistically, if you're doing, medical school stuff, like you do this so often that you're gonna get stuck. I only got stuck once, so I guess that's pretty good. Anyway, you don't do this. You use these, okay? And then you're gonna you don't want it all tangled and all knotted up. So you want it just like over here. And then when you go in, that's called a bite, okay? So you go in on this side. And then, so sometimes, I'm not gonna get into different types, but some types you can actually come out and then go back in this way. I'm just gonna do 2 in a row. So like through the skin here, 1, through the skin 1, and then through the skin 2, like all in one swoop. But if you do other types, you can come out first and then go back in, but let's not get crazy like that, okay? Okay, and then you come over here and you pull. You don't even have to close it, you just have to put some pressure, because all you have to do is pull through. And this is really long. I feel like they're not long like this in real life, but for practicing, it makes sense. And then you drop it here. Okay, and then you pick this long guy up, the one that's still attached to the needle, and you take it and you wrap it around once, and you wrap it around twice, and then you open this and you grab the little tail. And then you do close it, and then you pull it through. And then what would happen if I just left it like that? Yeah, it would just come right back open. So you gotta do another one. You'd only have to really do it one more time, like one loop for the second time, okay? And then you would do a third time with one loop. So the first one is 2 loops. I mean, it really, like, I'm sure some people do 2 loops and then 2 loops, heck, 3 loops, but I'm gonna teach you to do, the first time you do it through, you're gonna do 2 loops, the second time 1, and then the third time 1. And then, does anybody remember from last year how many millimeters you're supposed to leave when you cut? Should you cut it real close like that? Or should you leave it long like that? Okay. Does anybody feel that they could do it themselves after watching that twice? Whoa! So all of you that feel that you can do it, go to that side of the room, because this is gonna be the side of like the suture masters. Oh, I was gonna make a Star Wars joke, I'm still gonna do it. All the Padawans are over here, okay? So all the Padawans are over here. So after watching that, if you feel like you can do it yourself, please go over there, and then the Padawans stay over here, okay? Ready? Great.
Can we try it once? My feeling might not be reality.
You will just find out. I'll just find out.
Just speak it into existence. I have my own certificate, but I know it's like
If you have this.
well, I don't have my own. But
No. Okay, so anybody on the Padawan side have a suture kit? Go in the master's zone. You are gonna teach them how to do blood pressure. Wait, before you guys open your needles, I'm coming to identify needles. You and Miriam, hey, can I borrow your little notebook? Nope. I won't read it. It's not mine. Okay, I need to keep track of needles. So Miriam and Riley and Sid have one needle. I think it's just